What was shown was that the treatment plan, after a person gets one of these scans, changes in 67% of the cases, which was quite a surprise. It was expected that the treatment plan might change in about 30% of the cases, so 67% is quite a large change.
And what does that indicate about whether people are being treated appropriately now?
It indicates that there's a challenge in terms of diagnosing Alzheimer's disease and other dementias. So we know that there are many different causes of dementia, Alzheimer's disease being the most common, but it's not the only one. And there are many challenges to diagnosing what exactly is causing a person's dementia.
What is the current way doctors diagnose dementia right now?
Right now it's a clinical diagnosis, so there's no definitive test to tell whether a person has Alzheimer's disease or another dementia. What they do is they'll ask a number of questions of the person, the physician will take a family history, there may or may not be neuropsychological testing, paper and pencil, cognitive tests, things like this. Sometimes they may use an MRI scan, but the problem with the MRI scan, which can be very informative, is that it really only tells you about Alzheimer's disease once the disease has already progressed to a fairly high degree. Whereas this new scan, this amyloid PET scan, can give information about whether a person may have Alzheimer's disease much earlier in the disease process.
And why aren't PET scans being routinely used now to diagnose the disease?
The PET scans are FDA approved, and so they are available now for clinical use. The issue is whether insurance companies, including Medicare, should pay for them. And what we don't know yet is whether they lead to better outcomes for patients. And if they don't lead to better outcomes for patients, it doesn't necessarily make sense to pay for these very expensive scans. So what this study is all about, we know that it works from a research standpoint, but what we don't know is, does it make for better outcomes for patients? That's what this study is aimed at discovering.
This whole field of Alzheimer's research, it's a burgeoning field. There's a lot more money going into it, a lot more attention being paid to it. Why is that?
Every year, more and more people develop Alzheimer's disease in the United States. It's becoming much more prevalent than it has been in the past. Currently, there are 5.5 million people in the United States today with Alzheimer's disease. Virtually all of us know someone who has Alzheimer's disease, maybe in our own family. It's very, very common. As that continues, more and more people are becoming concerned about Alzheimer's disease. We know that now that people are as concerned about Alzheimer's disease as they are about cancer. And when you have that level of concern in a society, it leads people to take action. And we have, Congress has actually been very generous in recent years about increasing funding for Alzheimer's disease research as it becomes more and more a part of their radar.
There's a lot we know about Alzheimer's disease, there's a lot we don't know. Where are we on that scale, on that balance there?
That's a good question. We're learning more and more. Alzheimer's disease was discovered a little over 100 years ago. Since that time, we've learned a lot, but we haven't learned enough yet to actually create a therapy that can stop the disease in its tracks. And that's where we need to be. The good news about this increased funding that we've seen recently is there will be more and more good ideas that scientists can now pursue that there simply wasn't money to pursue before. I predict that we're actually entering potentially a golden age of Alzheimer's disease research. It wouldn't surprise me at all if in the not too distant future we have a very effective medication come out of clinical trials.
But we're not there yet.
We're not there yet. There are some medications available. The medications, though, are what we call symptomatic medications. In other words, they can treat your cognition for a period of time, but they don't do anything to stop the underlying course of the disease. Right now, Alzheimer's disease, unfortunately, is a death sentence, and that's what we're trying to change.
Well, thanks very much.
Thank you.